Dr. Ben Coughlin, the hands behind Many Faces of Chicago, here at SDMD in conjunction with Dr. Steve and Diane. Today we're talking about fillers, specifically the RHA fillers from Urbance. It's a really nice filler, has a lot of good qualities from a surgeon standpoint as well as ultimately for the patient. You know, the thing is we have a lot of these fillers, right? These hyaluronic acid fillers, there's some calcium hydroxyapatite, there's poly L-lactic acid, there's PRP, which is a more natural filler, there's fat transfer. These are all things we use to volumize the face and to decompartmentalize the face. So I'm going to show, you see poor Demi Moore behind me here. Hopefully this was some sort of a gimmick, publicity stunt, but time will tell us that. So why do we need fillers, or why do people get fillers? The face starts to compartmentalize with time. So that's the fat pads within the face separating from each other. So when you're 20, the face is round. You can't really draw a line from the eye to the cheek to the labial crease to the nasolabial fold. So these are, as we age, these fat pads separate and you start to see this demarcation. That's compartmentalization. These hyaluronic acid fillers are particularly good at helping that transition from the eye to the cheek to the lip to the jaw. So those are areas we're able to kind of paint with these fillers and really make a difference. That's kind of RHA's thing. They promote, and the science behind their filler does well in areas that are really mobile. So in the perioral area, next to the nose, around where the cheek meets the lip, the nasolabial fold. So I'm going to go into some of their benefits, and then I'm going to go into how fillers can be used incorrectly and cause a lot of problems. So here we have Demi Moore, right? So this was popular. She's on some runway show, somewhere with a lot of people watching, and she had this image, and it looks horrible. Why does she look bad? Like, what's odd? People are like, she looks bad. I don't know why. Look, there's no nasolabial fold. There should be a separation from the cheek to the lip. There's nothing. So either they did it with makeup or somebody way overfilled this upper lip to cheek transition because she said she doesn't like her nasolabial folds. They continued it out into the cheek here, probably with a filler that was too viscous, too strong, so something really firm. And then, the question is whether she had buccal fat removal or something like that. I do not believe so. I think there was maybe some sort of subcutaneous liposuction or subcutaneous fat destruction. People do it with deoxycholic acid. There's some theory that some of the devices can lead to that. So I think that's the mistake. The buccal fat pad is deep. The buccal fat pad goes, it goes past these facial subunits. So it doesn't lead to this sort of a deformity, but that's another lecture. So here she is, aging very gracefully, looks nice. She has thin skin. That makes aging happen a little, more prominently in certain populations. But the thin skin, you can see these fine wrinkles. But look, this looks better than this. Now she has a nasolabial fold there. Hers is relatively deep. Her skin is thin, but she's not 20 years old either. So it's a natural way to do it. So one of these RHA fillers. Now listen, we have in the U.S. right now actively we have 2, 3, and 4. They range from less viscosity, more like water, to higher viscosity, more like honey or a rubber kind of sensation, or consistency. So, around the lips, around the eyes, you want the thinner. So the RHA 2 or even the 1 when it becomes FDA approved here in the US or FDA cleared. And then the 4 or 5 even, you can do to augment the cheekbone, to define the jawline. So that's, if you find a surgeon, injector, doctor, dermatologist, whomever that you really trust and that has all of these capabilities and all of these different fillers, then they can recommend a specific one for each area. And you got to kind of have trust in those people at some point. The different companies market it differently, so some of them do better than others. But really, as a surgeon, we have I think almost 20 different fillers in the office. Probably with 5 of them, I can accomplish everything I want. And that's because I pick the different viscosities and the different consistencies to go in different areas and different patient populations. Because a thicker skin will allow you to use a firmer product to get to the same location as somebody with thin skin. You need a thinner product in that same location of the face. So let me expand a little bit more on the RHA fillers. So, it has let's talk about the two, because I think that's probably where the money's at. Has a really high or a significant degree of strength compared to its elasticity, its flexibility. So most of the time, those two metrics are inversely related. So the stronger you make a product, the less flexible it is. So that's really unique about this filler. It can be strong and flexible. So the perioral, even the nasolabial fold, under the eye, in the lips are really mobile areas. Those are areas, I mean, think about how many times I've contracted those muscles just during this little 7-minute presentation. This is something to take into account. I think that's something really cool that they did with the RHA filler. There's other fillers out there that are, comparable in ways, so I'm not dissing anybody directly, but it's about using what you like, getting used to it, and getting good results. This is my handy Mr. Snatch that I painted on. I painted the facial musculatures here, and then I'm showing how some of the creases go in the face. The frontalis muscle is, there's two bellies of the frontalis muscle, one on the left, one on the right, pulls the brow up. You get wrinkles perpendicular to how muscles contract. So this muscle goes up, causes horizontal wrinkles. This is the procerus muscle, pulls the brows down, creates that horizontal wrinkle. Corrugator pulls the brows together, creates a vertical wrinkle. The orbicularis muscles, a sphincter, lets you close your eye, creates these radial wrinkles perpendicular to the circular motion of the orbicularis, similar to the orbicularis ori. It creates these kind of radial, those are the smoker lines. In theory, smokers have them more because, I think now they're eating the gummy bears instead, so maybe there'll be new lines. Zygomaticus, there's some depressor labii. That's just how you move and, you make mimetic motions to your face and show expression. So, again, RHA has a nice role here because they have this really thin filler, or in theory, I'm going to say thin for patients, less viscous, more flexibility. You can put it superficial, meaning close to the surface of the skin to fill some of these wrinkles. Along with the toxin can be even better. So the combination of something like this is helpful. If you resurface it, if you take the top off, resurfacing is like, think about sanding a wooden floor with a crack. That's another option. So tackling these aging aspects from different modalities is helpful. The other thing that I do a lot of is this kind of facial sculpting. So this is the 20-something who doesn't need anything but wants to change the contours of their face. So for that, you want something a little firmer. You want the hard rubber sensation. So, you augment this cheek to give it a little bit of a prominence, create a peak here, some prominence. Maybe do a buccal fat pad removal here, create a contour here, use the strong filler, create a jawline prominence. Oftentimes, a little bit of a filler, a kind of depot of filler in this angle of the jaw allows things to pull back. It really helps create that, pull that kind of pre-jowl area posterior and lengthens that angle of the mandible, or that jawline, the body of the mandible. So what people like, they like a prominence here, a little bit of a shadow here, prominence here, a little bit of a shadow here. And so Demi Moore has that prominence, but they did it at the expense of taking away her natural nasolabial crease, which is why she looks so goofy. If it was just this depression here, she might look over sculpted, she might look, done, but this looks unnatural. So there's differences from those. This is the difference. Why don't you pull up can you flip the background there? We have other people who have made mistakes. So the freaking weekend. Look, so this was a publicity stunt, I believe, that's what people are saying. So he's really trying to get it out there that people are doing this to themselves, making themselves look goofy, and he thinks it's obnoxious. And while I appreciate that, I mean, he's like, he had that hairstyle, which was obviously a gimmick, and people could argue that also. But anyways, I digress. So this apparently was done with prosthetics and makeup, and they really exaggerated what we do, or what somebody could do with fillers to being the downfall of what fillers is. And there are people who look like this. So you know, be careful who you go to, be careful with which product is being used, in which location. You know, when people look goofy, they either did too much filler, they did the wrong filler in the wrong location, so they put the one that's like hard rubber under the eyes, or they did the wrong product. So not even the wrong filler, like hyaluronic acid, but they used the wrong, you know, they used calcium hydroxyapatite, which is a bone-like structure. So that's how you end up looking kind of a little bit odd. Or they went to somebody who just really doesn't appreciate these different facial metrics or facial alignments. So, okay, now we got Madonna. I'm a Michigan guy. She's from Grand Rapids. Like you could really say her jawline looks great. People would pay a lot of money. I'm sure she did pay a lot of money for this jawline. This kind of over sculpted again, likely enhanced with some contour. And again, where'd the nasolabial fold go? It's up there by the nose, but no, there's nothing here. We can't find it. You know, so a 5-year-old should be able to say cheek, lip, but they would lose it here. And then obviously she has way too much product there along the kind of mid cheek. You know, the lateral point of the cheek should be more here when this is her most lateral point. Likely because she told the doctor that she doesn't like these folds, so he way overfilled here. Again, this isn't buccal fat. Don't be dissing buccal fat. This is subcutaneous fat destruction or over augmentation of the cheek. Look, she's pretty. She looks great here. Maybe a little overfilled on this side. You know, starting to look a little abnormal. I think she probably is a little bit older here, or definitely is, and wanted that look, you know, when she was younger. And some of those just are unnatural, and you got to trust us to make the right recommendations on that. If you guys have questions, you know, feel free to ask them. Please text them in or however you do it on here, and I'll get directly to them. Can you pull that down so I can see the whole thing? So here's a nice result, right? So look, you know, this woman, let me just get back here. You know, she's just a little refreshed, just a little smooth. So this is a population that probably felt over-sculpted, over-aged here, and then we just smoothed in these transition zones in the next photo. All right, so, oh, good. This one, you know, not bad. Maybe a little over sculpted. I'm guessing this is the post here, or maybe that was the post on the other. Yeah, this is the post here on my side here. So you can see her eyes look great. They did a good job. This isn't my patient, but she got kind of this eye to cheek. It's a clear demarcation. Here we want a smoother transition. Looks great. Now her cheeks are really firm and widened. So she already had nice cheekbones, so, you know, but they're enhanced, so that's good. And again, these can, you know, if you do 1 syringe, you'll see small change. If you do 2, you see a little more change. You do 5 or 10 or, you know, more, you're going to start looking a little odd. The benefit of fillers is similar to the downfall. They're typically subtle. So if you do them right, there should be a subtle change. People say, you look good, you look refreshed, but they shouldn't be able to say, holy smokes, you got some filler in your cheeks. You know, this just doesn't look good. So yeah, I think, you know, again, I'll go back to my old little phrase there. Be clear with what you want, and then find somebody that you trust that can help you get there. Meaning, you know, you don't like this nasolabial fold. So, okay, one option is to fill it and to blunt it. The other option is to get the cheek to lift a little bit. And that really is what looks the nicest most of the time. You can do a little bit of filler here. Maybe a half a syringe on each side, but the best thing is to lift it a little bit. So obviously a facelift can do that. Threads can do that. Some lasers can do that. And a combination of threads, fillers, laser, that, you know, can maybe prevent a facelift. Ultimately, some people need the facelift, or not need. I don't like to use the word need here, but I want the facelift. So, you know, there's a couple ways to, or there often are many ways to approach certain problems. And the key is just to, you know, people got to decide how much downtime they're willing to put towards the process. They got to decide how much money they want to put towards the process. And then they got to really know what look they're after. So I like it when patients bring in photos of celebrities and things that they're trying to get, because I can kind of hammer down like, okay, why do you like this photo? They show me that photo of Debbie Moore. I'm gonna say, why do you like this? She looks weird, you know? So, and we can have an honest conversation about what they're after. And some people like looking different. So, you know, I think that's what I have to say. I think we're having actually a Revance and RHA week coming up here in the office. So by all means, take advantage of that. There's some special packages and stuff people are putting together. But we're getting great results with it. I think it's a good product. If there's any questions, let me get to those. This is a Topo Chico, not a beer.
Loving your lecture. Is there any risk that filler stretches the skin or prevents healthy aging?
You know, it's interesting. I feel like I've been getting this question a lot lately. So the amount of filler, you buy filler by the 1 milliliter, so about by like a thimbleful. You know, you can't overstretch that with one. Now, if you really put, overpack the lips or periorbital area, you could possibly lead to some sort of skin stretching. I think it's more a little bit of an illusion for people. So let's say you put filler in my cheeks. I start to have this demarcation of my cheek fat pad from my nasolabial fat pad. Let's say I fill this. It looks great. Then a year later, the filler goes away. I'm like, oh man, they stretched my skin. It's looking shitty again. So that's because the filler's gone and I'm a year older and now my skin looks older. So I think that's probably more the play. You can't stretch the skin to the point of over-aging it with the fillers in my experience. So that's my 2 cents on that. All right, yeah, so, again, any questions, you can email them. Paige will email this out to people who were signed up and weren't able to make it. And then we'll post it on the World Wide Web. And you guys can check it out. I think that, how long did we go there? I think it was long enough, no? Yeah, so RHA Fillers, come and get them.